Okay, so now it has been 30 minutes, so I'm going to enter my patient's room with the IV antibiotics running, the Roseprin. So I'm going to enter.
Yes, come in.
Hi, can you verify? I'm Jasmine again. I know I'm back. Can you verify your name and date of birth for me?
Yes, Miss Anderson, May 17th, 1956.
Great, Miss Anderson. I know you get tired of that, but we have to do it every time.
Okay.
Okay, Miss Anderson, I'm glad to see that your antibiotics ran well. I don't see any infiltration or anything in your lung. I'm going to go ahead and wash my hands and apply my gloves. I'm going to disconnect your tubing this time. Your antibiotics, you can roam freely for a little while.
Okay.
All right. So make sure everything is stopped. And it is, because it's finished. Alright. Alright, so
I'm really tired.
I'm going to disconnect her tubing.
It's sitting right here in front of me. Before I do that, I'm going to check the radio pulse.
Alright, just hang this.
Okay, and then I'm going to write
And I'm going to use the A-Stash method with my 3 mLs of saline. I'm actually going to unclamp. And I'm going to clean my port.
Go and double side up, about a 15-degree angle until I get
Attach my syringe and use a push stop method. Open up my line. Stop it every half ml and administer. Be ensuring before I let the last few drops go out to apply positive pressure in the line. Okay. So now that that is done, if heparin was ordered, I would administer the heparin after this time, right after the flush. But it's not, so in this case, I'll just detach, get my tubing, and apply my alligator clamp or any kind of devices that the facility might use to keep the tube sterilized until the next administration of IV medication. Okay, and as far as documentation, I will be, okay, and I'm going to throw all my needles and all my syringes that I use in my sharps container. And as far as documentation in the MAR, I would state the time the drug was administered, how the patient tolerated the dose, the route, the condition of the IV site, which is it was in well condition and it flushed easily, the volume that was infused, as well as the INOs, including the IV medication she get as long as her oral intake as well. Thank you.